Eco Club International is a conglomerate of about 25 different chapters across the globe that are made up of Lagosians. Currently, we have one active chapter in the UK, we have one active chapter in Canada, and 23 within the United States of America. And these are, again, mostly Lagosians in the diaspora who are professionals in their various fields. And as part of that, that's why we're here on the medical mission. This is something that we started back in the year 2007, and we've been coming home every other year since then. And when we come here, like we do today, it's a show of support, partly for the community, partly for the government. We're showcasing our support principally in healthcare as we give back freely to our communities. This mission, 2024 Medical Mission, we'll be visiting 5 different locations. We're here today at Ayobo, and then tomorrow we'll be going to Lagos Island, and subsequently we'll also be going to Ejinre Kingdom. We'll be going to Ipakodo, and also we'll be going to Egbeda. Part of what we do is we bring from the diaspora healthcare professionals who are doctors, nurses, lab scientists, and so on and so forth. And when we get here, we partner with our local partners who are also either medical people and logistics people. We also partner with community hosts and community leaders so that we can collaborate on a seamless operation of giving back to the people within the community. So far, this is typical. On the average, we see about 500 per location. So far, Ayobo, I think we're already seeing over 500. And it's kind of early. We cannot say right now that this is it. But at the end of the day, we will be able to tell specifically how many people we have seen. We give out cards, so the cards will kind of guide us as far as how many people we have seen. So typically about 500 on the average. Okay, so the part of the mission of our organization is to augment or support what the government is doing. We understand that the government cannot reach everybody at the same time, and that is why our focus is on giving back specifically in communities that are underserved or underrepresented. And there are so many ways we can measure impact, but the subjective way, one subjective way is when you see people, you are giving back to people, you will see the appreciation. People will pray for you, and people will pray for the organization. That's one way of measuring impact, and it's subjective. And there's also data analysis. We have a set of data experts who are collecting data to see, like variation. How many people are we seeing who have maybe diabetes? How many people has high blood pressure, and so on and so forth. So we have data on that we can use to essentially plan for the future. So if we are coming back here, we already have like a representative data that speaks to what the need in the community is.